Well, now to our GMA cover story, and Chrissy Teigen revealing she's using Botox to help her struggles with headaches while pregnant with baby number 3. Ariel Reshef joins us with more. Good morning to you, Ariel. Good morning.
Good morning, Eva. Teigen has built a brand with her bold honesty, often opening up about all aspects of her life, including her struggles with infertility and postpartum depression. Now she's letting fans in on her decision to use Botox to help treat her painful pregnancy headaches. She's the superstar mom, mogul, and successful author who's known for being an open book.
There's nobody else here.
Now, less than a month after Chrissy Teigen and John Legend revealed they're expecting their third child in Legend's latest music video, Wild. The 34-year-old getting candid about her pregnancy pain and the eyebrow-raising treatment she's using, tweeting, "I get really bad pregnancy headaches, was thrilled to be cleared to do neck muscle Botox." Teigen telling her 13 million Twitter followers she's also using beta blocker shots to help with the headaches, which she says she struggled with during her second pregnancy as well. "I love being pregnant. I like it more than not being pregnant, but the headaches, my God, the headaches. Someone please help. Don't say water or Tylenol or iron or magnesium. I need witchcraft." While headaches can be pretty common in pregnancy, experts say one of the main concerns is the medication used to treat them, some of which may be harmful to the developing fetus. According to the FDA, when it comes to Botox, there are no adequate and well-controlled studies in pregnant women, and it should be used only if the potential benefit justifies the potential risk to the fetus. The mom to 4-year-old Luna and 2-year-old Miles calling Botox life-changing for treating her regular headaches caused by jaw grinding, and she said she even used it behind her eyebrows for migraines. Despite a painful start to her pregnancy, Teigen now says, "I see the light. Finally." And Teigen says it is optimal to see a neurologist who can assess your personal situation and coordinate the appropriate treatments with your OB. And of course, it's an important reminder, as always, to consult with your doctor before seeking any new medical treatment. Eva.
Ariel, thank you. And Dr. Jessica Shepard joins us now from Dallas. Dr. Shepard, first, let's just talk about how common are severe headaches and migraines during pregnancy?
Now, what you would see is that actually headaches are very common in pregnancy. And usually when we think of migraines, women are 3 times more likely to suffer from them than men. And they usually appear during their childbearing years, which is exactly what you've seen here in Chrissy Teigen. Now, when we think of migraines, they actually will peak during the first trimester and usually decrease throughout the rest of the coming pregnancy. Now, it is important when you go to your doctor to make sure that if you are a migraine sufferer, that you let them know.
Us women, we start to really be concerned about what we're putting in our bodies when we're pregnant. Chrissy Teigen turned to Botox for her headaches during this pregnancy. How safe is that, and what do doctors typically recommend?
Now, when we think of migraines and in pregnancy, I myself am a migraine sufferer. We typically will start with over-the-counter medications such as Tylenol, but there are certain medications that are used for migraines that we typically try to use sparingly throughout the pregnancy. Now, when we think of an alternative treatment such as Botox, I think that is groundbreaking. Now, you'd mentioned before that it is not FDA approved, but there are studies as recent as this year, 2020, that show that Botox use in pregnancy for migraines is actually relatively safe. So the important part is to make sure that you talk to a doctor who's very comfortable with using Botox for the treatment of migraines.
Now, for a pregnant woman suffering from headaches who says she's tried everything, how would you recommend they go about approaching their doctor on the potential use of Botox?
Now, it's very important that you discuss the history of headaches that you've had prior to pregnancy, and also making sure that you discuss your migraines and what those triggers are for your actual migraines, going through actual treatments that you've used in the past and discussing how that might lead into therapies that you may fail, and also the possible use of Botox, and making sure that you think of that as an alternative and talk to an OBGYN and neurologist that are comfortable with using Botox for the treatment of migraines in pregnancy.
Some good advice this morning. Dr. Shepard, thank you, as always, for being with us.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here. to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.